I'm Dr. Lee Morissette. I'm the medical director here at the Center for Asbestos-Related Disease. And I'd like to talk about our lung cancer screening program. This is for people who are diagnosed already with asbestos-related disease, who are between the ages of 50 and 84, and have at least a 15-pack year smoking history. For example, you smoked 1 pack of cigarettes a day for 15 years, then you have a 15-pack year smoking history. Both smoking and asbestos are linked to lung cancer. People who smoke have an increased risk, but non-smokers who have asbestos-related disease also have an increased risk of lung cancer. For people who smoke and have exposure to asbestos, the risk is drastically higher. We always attempt to coordinate the lung cancer screening with the individual's annual asbestos-related disease exam. If the patient is local, the lung cancer screening CT is scheduled at Cabinet Peaks Medical Center a few days ahead of time so that we have the film and the report to review before you come in. During the visit, the CT scan is reviewed with you and a determination is made about when you should have your next one. The usual frequency is annually. If you are not local, but you're still coming to CARD for your annual visit, we will usually order your lung cancer screening CT earlier on the same day that you're having your appointment. Often that means that we do not have the film or the report to review with you, in which case, once we get those, they're reviewed by the provider and the medical director if needed, and then there's a telephone call set up to review those results and make a disposition about when to come back. The patient is not local and they're doing their visit through our long-distance diagnosed program, then we send an order for the lung cancer screening CT to their local facility to be done. And then we get the results and the film back, and it's reviewed by the provider and the medical director if necessary before the telephone call with their provider. At that time, the provider will go over it and make a recommendation for when it needs to be done again. All of our lung cancer screenings are sent out to ILCAP, which is the International Early Lung Cancer Action Program. These are cardiothoracic radiologists who specialize in lung cancer screening. Once we receive that report, it's reviewed and compared to the report from the radiologist that read it initially and the provider. If there's any discrepancies, then the medical director determines when the lung cancer screening should be repeated. Final disposition is then communicated to the patient. If it's normal, the patient receives a letter. If there's anything that needs to be repeated or it's abnormal, then the provider will call the patient to discuss it. Through this lung cancer screening program, CARD has identified several early cancers that were able to be successfully treated. If you think you qualify, please give us a call. We would love to help you get into our program.